Okay, great. Thank you so much. Comes to my attention that I'm giving all the talks at the end of sessions. There must be a reason for that.
Say the best to last.
Yeah, I'm not sure. But anyway, so I had a couple of comments to the prior two fantastic presentations, or the three fantastic presentations. First of all, Dr. Seuss was from Springfield, Massachusetts. And I used to take my kids at the Quadrangle, a section of Springfield that has big square with 4 museums, one of which is Dr. Seuss, and in the courtyard there's big elephants and all these things that he did. But anyway, so yeah, my children were Thing 1 and Thing 2. And then the other thing about vegetables, like in fruits and whatever. So how to clean them. Water is full of bugs, usually. And so the best thing is white vinegar. Water and white vinegar, you keep it in there for a while and then you don't rinse it anymore and that's it. If you don't like vinegar, that's a problem. Okay, so this is an interesting case. A dermatologist came to see me and says, Joanne, I have something interesting. I need your help and whatever. And obviously, I'm not a dermatologist and I don't understand these lesions. So let me tell you. So we are dealing with a 71-year-old female with a remote history of breast cancer. Doesn't have anything to do with it, but otherwise healthy. So she was not immunocompromised. She presented to the dermatologist with a lesion on the left thumb near the nail bed, and of significance. The patient also frequently went to the farm to get her eggs, milks, and whatever. And she also was very fond of petting the animals around, and goats were among them. So the lesion on her thumb became a blister, and it was biopsied at the blister stage. And I have only a picture of I'll show you the pictures of that. So the dermatologist differential included ORF virus, a pox virus, which is also, ORF is also a pox virus, but there are all different types of pox viruses, and I'll show you that, or herpes or tularemia. And the lesion also spontaneously resolved in 6 weeks. We didn't have any material except for the formalin fixed tissue. So when we are looking at the classification of pox viruses for veterinary importance, I was very struck because among all the animals that you see on Dr. Google, there is no goat ever represented. But in this case, we think that it is the goat. It could have been a cow also that induced this. Now, among the Pox viatidae, you have different species. You have the one that's associated with the insects and the one that's associated more with larger beans. And the ORF virus is part of the parapox virus. So the ORF virus infects goats and sheep, and it can cause pustules and scabby lesions, primarily on the muzzle, the lips, and the nostrils, but can also appear on the teats and the other in the eyelids. And so, petting, and you usually see a lot of these infections during the time of the petting zoos for the children, right? So everyone goes and pets these animals, and so you can have a little epidemic of these infections. But thank God they resolve quickly. So there are different phases of the infection as they appear clinically. You have the maculopapular stage, the target stage, the acute stage, regenerative stage, papillomatous stage, and regressive stage. And these all occur in the span of 6 to 8 weeks, and they resolve spontaneously. This is the thumb of our patient, and this is if we go back to, this is the target stage where you have a bull's eye lesion with pericentral clearing, and this is the actual acute stage where you have the ulceration, and it's at this stage that the patient was actually biopsied, but the dermatologist did not have any images on this on the thumb. So this is from DermNet. So the histology, the punch biopsy demonstrated a blister, and with some scale. You can see very nicely that there is this the thickening of the epidermis and also the extension of the rete ridges, very long rete ridges. You have at the dermal epidermal junction, you have this ballooning degeneration and clearing and edema. And at higher power, you can see a cell debris, but this ballooning degeneration of the keratinocytes. Now going on more high power, and this was 60x or 600x, you can see these, you go into Google and you see, okay, what are you looking for, right? And so anything that looks round and pink all of a sudden must be a virus, right? This can not be a virus, but if you look carefully, there are other areas in here that may look like what they demonstrate on imaging and on the books. And the pox is a large virus, so you should be able to see it on H&E. I also had, so these were a few discrete eosinophilic inclusions, but I also had this inclusion here that looked to me like a Cordry type A inclusion, but there were really no features of herpes otherwise. So in the context of the clinical impression, the findings were really more suspicious for ORF, and that's what the dermatologist came to me with. The dermatologist came to me with, this is ORF, we need to go after it. So, differential would be for us then the ORF virus, or also a Milker's nodule. This is the bovine parapox virus. This is a pseudo cowpox. So you have the cowpox, which is the orthopox virus, and then you have the Milker's nodule, which is the parapox virus. So it's quite confusing sometimes. But anyway, these are different. They look slightly different. And then you have pyogenic granuloma. Obviously, that's not infectious. Tularemia, that was one of the differentials of the dermatologist, was not considered because that's usually very typically granulomatous inflammation, and so we didn't even think about that. And then the herpes, multinucleated giant cells, the nuclear molding, the clearing, and the Cordry type A inclusions. Although we thought something that may look like one, it was also not in a differential. So what are we looking for then by electron microscopy? So we are looking for, first of all, I was telling you, we only had paraffin embedded tissue. So we looked at the slide and we cut out a few sections of where we thought it was appropriate to do electron microscopy to look for the virus. So we are looking for an ovoid or oval-shaped particle that is about 200 to 300 nanometers in length and 140 to 170 nanometers in width. So, up to 300 in length is quite large. So, and then what you're looking for particularly, and what the arrow shows here, is that so this virus has the coat, it has an outer coat, and then it has a membrane, and then it has in the center this dumbbell-shaped figure that you can see here with this black line. And that is very, very characteristic for parapox viruses. So electron microscopy, and I must say, since it was mentioned that Dr. Sarah Miller doesn't look at any images without the bars. I had bars on all my images for her, so that she didn't complain about that. But we were seeing these things, and we really weren't sure. Are these melanocytes? Or not melanocytes, melanosomes, or are these particles? We didn't really know what they were, and so you can see here other particles, and again. Among the tonofilaments that you see in the keratinocytes, you see all these other little particles, And so it was really, we really didn't know what we were looking at. These were definitely much too large for what we are looking for. And, but they seemed to be interesting. And one thing that caught my eye that was interesting is this section here that I show you then later. So I sent all these images. This is my first set of images. I sent these to Sarah. So Sarah comes to the rescue. And, most of the micrographs you sent do not contain viruses. Okay. So she sends me all these pictures, and so, okay. So this one here I got actually from Google. And this here is, this was from Science Direct on Google. But anyway, so this shows two different types of pox viruses, the orthopox virus and the parapox virus. So I was telling you the orthopox virus is the cowpox, and then you have the parapox virus, which is the milky nodule and the ORF virus. And they all consist of this. I don't see, but maybe it's better if I do like this. It's a very small screen, by the way. And when you get older, it's much more difficult to look at it. So you have an envelope, right? So the difference in these viruses is there's not much difference. So, may well be that we have both of them or just one of them or none of them. But we have the envelope, then we have a surface membrane that has these spikes. Now, in the orthopox virus, we call them tubules, and in the parapox virus, these are called filaments. They both have this lateral body, and the difference is, and they both have also this dumbbell-shaped appearance inside, but one contains more of the nucleoprotein is disorganized and fragmented, while in the parapox virus, this is according to Google, Sarah, I don't know, but this is more of the nucleoprotein is more condensed into well-defined structures. So these are all the images that Sarah said that Dr. Miller sent me, and that are completely educative for me because I didn't know any much about the viruses. But anyway, so this is the negative stain of the virus, how it should look like. So the parapox virus is the DNA virus. And unlike all other DNA viruses, it actually replicates and is present in the cytoplasm and not in the nucleus. So here you have the cytoplasm of an infected cell that has multiple different stages of the organelle. And at higher power here, you can see that some are immature viruses that have an electron-lucent center. Others are the maturing ones that have more of the center starting to condense the DNA. And then you have the mature virus that has this well-formed dumbbell-shaped structure. And in the corner here, I magnified it for you because it's very hard to see, but the magnification is very pixelated. But the point is that you have this curved so the starting of this cup, it's a cup formation, and that is not circumferential and becomes circumferential as the virus matures, and then it entraps all the DNA. So this is a vaccine, and this is the orthopox virus image. This is correct, right? This is the one. It's not a parapox, but it's the orthopox, and that would be the cowpox virus among them. I'm mentioning the cow because there were also cows on the farm, but it has a similar growth pattern, and you can see here in this image very nicely there is some granularity, but it's spikes. There are little spikes and filaments that are sticking out. And here you have a maturing and a more mature virus with a clear center. This is more of the pox virus, what we're looking for in sections. And just to say that these are all well-prepared tissues, so well-fixed and properly prepared. And so they show really beautiful images. You can see really very clearly the structures. I had paraffin-embedded tissue, so it's not necessarily the best. But as we understood yesterday from the talks, you can actually do quite a lot with formalin-fixed tissue. So here we have, again, this immature particle where you see this, how you say it, this little cup that is forming bigger, is becoming bigger, and it's closing in. And then you have, this is the cytoplasm with a lot of these viruses. Just to compare, you have here the mitochondria. So these again are virus particles with this closing of these immature structures, the curve, and then they have the curve codes. Let me see that here. This is a representation of one of these where you see the dumbbell-shaped appearance within the center, and then a very nicely curved coat. This is a comparison, a ribosome that has more of an angulated coat. So it's quite different. And you can see that the center of all these viruses is quite, you can see this, imagine this dumbbell-shaped structure inside, which can look either dumbbell-shaped or can have different appearances depending on how you cut your section. And this is a higher power, but it doesn't look too clear from here, actually. So I went back to the grid and I took more pictures. And not that they get any more clear than what I have, but this looked like something that could be suspicious for a virus. It was a little bit large in length. Usually the length is about 300 nanometers. This was 500. But it has these structures inside that reminds me a little bit of the orthopox virus in a way. So that could be an organism. And then there was this other area here, among the tonofilaments, you have these structures that look a little bit interesting. You also have here something that is bits and pieces of something that may be the beginning of these cups that, virus cups that are forming. Here you have a structure that, could be something with maybe dumbbell-shaped something inside. You have to have a lot of imagination in pathology. And then, most importantly, I think, this is a cell junction here. Most importantly, you see this structure here that looks very much similar to what we were seeing from the images that I was provided by Dr. Miller, that you have this outer coat that's forming, it's formed first as a cup and then it circumferentially closes. So, who knows? So another possible structure, again, too big, but it has also this side that's not closed yet. So, maybe it's just cut in a way that you see it longer. And then, most interestingly, there was this image here where it shows somewhat of a huge dumbbell-shaped kind of structure. And these other structures here, particles with these, if you think about it, these ciliary or filamentous projections at the periphery. Now, regarding this structure here, we were talking about how you cut these, and so I was discussing that with Dr. Miller, if you cut these sections in a different way, then what you're going to get on your grid is not necessarily what you are looking for. So you really need to cut very much. So what you have here is, if you have the virus diameter that's 200 to 300 nanometers, and you actually cut at this level, then you and you put that section on your grid, then you will miss the dumbbell-shaped appearance. And then the structures that we are seeing that have all these more dense other structures inside could either be part of the virus DNA nucleoprotein assemblation, or it could be that you're actually cutting through the filaments or the tubules, if you will, and that you're seeing that you're looking at from above. So, it's very unclear, what we have. So at the end of the day, we end up with, we are not sure if this was really ORF, and it may well be ORF. A lot of the structures that we imaged originally may be melanosomes. So, importantly is that the patient got better. We didn't have any fluid from the blister to work on. And we also didn't attempt to do any of the fancy techniques that Sarah told me that I should try. So at the end of the day, who knows? But I think that this is a very nice example of, trying to figure out, and again, going back to what Sibel said, if you don't know, you have plenty of experts in the field, and particularly one particular one in virology, Dr. Miller, and you really need to call people. Don't be shy to call people and ask them. So I'm going to leave you with this, since I was telling you about melanosomes. So melanosomes are melanocytes right at the dermal junction. But the melanosomes actually are present in keratinocytes because they extrude from through vesicles. They extrude from the melanocyte into the keratinocytes, and then are around the nucleus and protect us against the UV light. Any guesses? What's on the left and what's on the right? Everyone knows, right?
I've seen it before.
You've seen, yeah, but I mean, it's this shyness of answering questions, like at meetings. A vote, okay.
Which one is virus?
Which one is virus?
Okay, is the one on the left virus? Anybody want to vote for that one?
No?
Nobody's voting? Okay.
Okay, what about the right? Okay, yeah, okay. Good.
Learn something.
So this is a pox virus, and again here, I actually did, magnify this a bit to show you that there is structures inside, while the melanosomes is very much denser. And so what about this? And what about this? So these are negative stains. And so what do you think is what? And remember, this goes back to the talk of Dr. Miller this morning. So if you were paying attention, you're not sleeping. Any votes on the left side? Yes?
Yeah.
A virus? Well, it's a virus, yes.
What kind?
But what kind of virus?
That's acceptable.
Yeah, acceptable. So if this is a virus on the left, what is it on the right? Is it not a virus?
Nuclear form. This is a negative stain.
There's a negative stain.
It doesn't matter. It's a nuclear form for me.
So this is a pox virus. Remember the images that I showed you, right? The cartoons. you have the surface of it has these filaments or tubules, and so you can see that very nicely here, actually. I think that's what we are looking at.
Yeah.
And then, yeah.
I like, excuse me 1 minute. I like to think of the one on the left as being wrapped with rope in one direction, and then somebody came along and wrapped it with rope in the other direction. So it looks like it's wrapped with...
Basket weaving.
Yeah,
No?
yeah. Okay, I'll take that.
Yeah. Okay, so but we had one saying, okay, this is a pox virus, right? The parapox virus. What about the other one? We have nuclear pore, okay.
Ask him.
Coronavirus?
A coronavirus.
Okay, how big is coronavirus? Size matters.
It's not that.
You got it.
It's
Yes.
not that big. It's just like.
This is, yeah, exactly. So it's way too big to be coronavirus.
Yeah. And the bars are 100 nanometers, so you
Yeah.
can see that.
Kind of brick shaped on the right. Right?
Right.
And she's already told you.
So this is the orthopox virus. So we're talking about about the two, the orthopox being the cowpox and the parapox virus being the orf and the milky nodule pox. Viruses. So it's but they look different. So that's it really. Oh no, I have this one. What is this? What are these? Okay.
What else do you find in skin?
So those were viruses. So this must be also a virus, right? So what is this? And I talked about it.
Bacteria.
Anyone?
Bacteria.
Okay, that's not a bad guess. It's about in the range of a mycoplasma, but they all sort of seem to take a shape, whereas the mycoplasma were like beach balls.
Beach balls.
In other words, pliable. Dr. CRISI has already said something about these things being in skin and her thin section.
Mimickers.
What protects you from the sun?
Okay.
Yeah.
So
So these are melanosomes. And, it's they don't look too dissimilar, particularly this one, like you could imagine that there is some string or basket weaving in that one, but these are actually. Oh, can you push stop on my phone?
how do you isolate them? Like,
Sarah?
Grind up skin?
Yeah. Which I can see.
Yeah, right.
I mean, you're not going to see this as negative stain.
This was specially prepared by this by Hans Gelderblum, whom I
Yeah,
know.
you do that by looking at different smells and
Exactly.
Do that. Or the certification. So
These were extracted
Yeah.
and put into water. The extract put onto grids for the purpose of demonstrating
Yeah.
these things look like viruses. And if you've got a lesion that is normally on skin, pox viruses,
Yeah.
herpes virus, tularemia, and you're trying to differentiate something like this that's normally wear on skin, that it's just something you need to be aware of. That's not trying to teach you what melanosomes look like, but that there are confusing things.
So I should say this, the aspirate blister.
Yeah.
So from blister,
Yeah.
which we used to do, for herpes and for various things. And so if we do that, I've never really seen melanosomes since last week.
I guess you could. Did everyone hear Dr. Hicks's comment? If you have a blister, you've got a lesion where skin cells are dying and in the milieu of the pus and the other stuff. It would be possible to get some of these.
Yeah.
I once had a case where the physician called me up and he says, I have this student, it's in student health. I have this student who just came back from, I think it was Vietnam, visiting her family, and she had this lesion on her neck. And he said, I don't know what it is. She's been exposed to chicken pox, but there was just one lesion. And I went down there with a TB syringe. I think he thought I was going to, he had all this assembly of scalpel and slide, and I just used a TB syringe, extracted some fluid from the blister, took it upstairs, took me 30 seconds to walk down, had the sample in hand in 2 minutes, took it upstairs, negatively stained it in 15 minutes. I said, it's a herpes virus. So he did have chicken pox.
I like to finish with thanking, first of all, Dr. Duke, the dermatopathologist that has his office just next to mine. And he always comes in with, vasculitidin of, like sharing them with me. So it's, and then, things that need to have any electron microscopy. Hina Ali is our, the EM coordinator. She's great. She's a junior, and she trained. She did all the training, and she's completely qualified. And she's a very smart young electron microscopist. And then obviously Sarah Miller. She's her. She's fantastic. And it's interesting because I was thinking, sometimes you send a message to someone to say, could you help me? I have this case and whatever. And they never reply to you. But you send something to Sarah. Sarah will always reply. And Sarah will always then take it way further than you wanted it to go. And so that's fantastic. So that's the passion that she has in electron microscopy in general. So thank you very much, and enjoy your the rest of the stay.